Hi, my name's Brittany, and I have Crohn's, psoriasis, and I'm extremely fluffy.
Hi, I'm Dr. Jennifer Soung. I'm a board-certified dermatologist and clinical researcher at Southern California Dermatology in Santa Ana, California. I'm also a clinical faculty at Harbor UCLA. I specialize in psoriasis.
Hi, Dr. Soung, how are you?
I'm doing great. I'm so excited to be here with you today, and I'm excited that you're going to be sharing with us what your journey has been like with psoriasis.
Well, I'm happy I found you because before it was a much harder journey to go through. In the past I had gone to other doctors and they weren't so good on bedside manner, and I came out in tears usually because, my weight's always been a big thing. And when I first saw you about my psoriasis, when my hands were bleeding and my feet were bleeding and I couldn't stand more than 15, 20 minutes, I couldn't walk. You helped me through all of that because you were so nice and kind and very knowledgeable. Other doctors in the past about my weight have been very rude and obnoxious about it and just calling me obese and saying I need to, eat less or things like that. And I just, I never had that pressure with you. I never had anything that I felt uncomfortable because you took my health concerns very seriously, and you were very knowledgeable about what I was going through.
Brittany, you bring up something really, really important, which is we all have, you as a patient, me as a healthcare provider, our own biases about weight and weight management, right? Is that it's a really tricky topic. There's a lot of social stigma. It can feel really kind of shameful or embarrassed to talk about. And I think it starts with acknowledging one is that people who are living with obesity, it's not a willpower problem. You and I have talked about this many times over, where you shared with me over the years, you are someone who has been so diligent about your lifestyle, exercising all the time, and you come back here and you ask me, why have I not lost any weight? Because we now know that obesity is really a complex disease. I don't even like using the term obesity, to be honest.
I hate it. I hate it.
Yeah, I focus on weight management. I'm talking to other, in this video, we're also sharing this with other healthcare providers. So, and the medical term is obesity. And so I want to define it. And it's really a complex disease that has to do with genetics, your metabolism, and also lifestyle. So it is truly multifactorial. So when we're wanting to help patients living with obesity, we're talking about a multifactorial approach. So I hear your struggle, and so for me, I've learned so much about how to address it in a sensitive way. And so, one of our first conversations, I remember that I think it's important starting one with hearing you. And I always want my patients to feel heard and seen. And then two, asking you for your permission. Is this something that you're okay to talk about today? In other words, would it be okay if we discussed your weight today? And so I feel like when you open up like that, it gives you permission to, I'm asking you permission. What direction you want to take this in?
Yeah. And I appreciate you asking about it instead of just saying, looking at the charts like some other doctors I had and said, oh, you're obese. There's nothing I can do. There's nothing I can help you. It's easier to talk to someone who addresses you in a not attacking type of way. And I feel like that's the beautiful thing about our patient-doctor relationship that we've had. Because I originally had Crohn's, and one of the side effects from the Crohn's gave me psoriasis, and that's where I met you. But not only were you knowledgeable on my psoriasis, you're also knowledgeable about my Crohn's, in that direction, and knowing what medications helped both Crohn's and psoriasis. And that actually got me out of a huge slump I was in.
Yeah. And what you're bringing up is really systemic inflammation. And whether it's your Crohn's disease, which is another autoimmune disease, but also weight being a factor in causing chronic or contributing to chronic inflammation. And that's why I believe in treating the patient as a whole. I'm a physician, and so I cannot just treat your skin in isolation without addressing everything else. And that's why we're here today, is to share with other healthcare providers and patients, is that treating a patient with psoriatic disease is really about an integrative approach. And I want you to be healthy on the inside and out. So as doctors, we very much also like to look at the numbers, right? So part of evaluating your weight includes what you mentioned earlier, like checking your glucose. So we look at your sugar levels, your A1C, your lipids, and other kind of markers like your body mass index and even your waist circumference. So that gives us some concrete or objective information, right? And then from there is helping patients understand that, in fact, this chronic inflammation from both the skin or psoriatic disease, some patients can have joint pains as well, and then the weight contribute to this state of chronic inflammation. So, in fact, treating both can help you improve your overall health. You were also someone who shared with me early on that lifestyle, diet, exercise were really important to you. And so you asked me questions like, what else can I do to improve my health, minimize my psoriasis flares, or even just minimize the flares of any autoimmune condition? And so I felt like you were someone who was really curious about, okay, what else can I do? And so early on, we had talked about losing a little bit of weight can help with overall inflammation, not just the psoriasis, but also your Crohn's disease too. And so was that something that you felt like there was a lot of information out there about, or was that kind of surprising to you? I'm curious from a patient perspective.
So from a patient perspective, it's kind of funny because not a lot of doctors talk about food. They talk about like, oh, take this or do this, but it's not like you should cut this out or do this or that. Like, I remember we had a conversation before I went gluten-free about you being like, have you tried being gluten-free? And I'm like, eh. But it was like really something that once I was like dedicated to do it and I did it, like it totally helped me.
I think diet, as you and I have talked about before, is very individual, right? I think there's a clear difference between a true gluten there's a difference between a true gluten allergy and a gluten sensitivity. And that's a distinction I want to make. And so there are tests for patients who have a true gluten allergy. But in your situation, it's a sensitivity. And I think I'm very attuned to that everyone has an individual diet. It's very personal, it's cultural, it's social. And so when we talk about what are the best foods, sometimes it can be really tricky. And I really focus on an individual approach, first of all. And then two, what we see in the evidence, and this is what I share with patients, that my approach to when I talk about weight management really comes from a place that I want you to be healthier as a whole. Well, recently, Brittany, we had a conversation and you came in as for follow-up, and you kind of shared with me, you said, Dr. Soung, I am ready. Tell me what the tipping point was.
So I got married like a year ago, and it was so hard for me to lose any weight before my wedding whatsoever. And since then, whatever weight I did lose, I've gained, and I've been trying to cut calories. I've been eating healthy. I've been doing everything. And my husband and I are also trying to get pregnant, and we've been trying for about a little over a year consistently. Nothing's happened, but I was at an event, and one of the like event helpers who I've known and had a conversation with in the past and everything. She
Brittany, I
knew
think
that,
this is unique. Share with us what you do for a living,
oh,
because
I'm a
you're in a
photographer.
visible place. Yeah.
Yeah, I'm a
She's a
photographer.
photographer to a lot of famous people.
I love my job. I have the best job ever. I actually like I'll show you some of my artwork. That's a photo I took. But I do a lot of event photography and things like that. And I was actually at a really big fundraiser event. I don't want to like say what it is, but there was a lot of people there, a lot of famous people. But one of the staff girls who I work with this company a lot, and they were really nice. They're at all the big the big charities and things like that I shoot. She came up and she was all excited and she was like, "Oh my God." And she came straight to me and grabbed my belly, and I was mortified. And she's like, "Congratulations." And I'm like, "Not pregnant, just fat." Like, and it was like a group about 7 people, and everyone just turned around and walked away. And I'm just like, so, and then literally right after that, I was babysitting my nephews, like the next night. And, it was a sleepover, spend the night thing. And, my oldest nephew, and the 4-year-old, they were on the couch and they were giggling about something. And there was a little boy that popped up on the TV, and the little one was like, "Oh, he's chubby. That's so funny." And I'm like, "It's not nice to call people chubby. Like, no one can help it." And that guy's a kid. Like, he doesn't know, like, he doesn't know workout routines and what to eat and all that kind of stuff. And then my oldest nephew was like giggling, and then he goes, "He's chubby like you." And I was like, "Oh." So it's like even my nephew is like, "Yeah, you're chubby." And it just, it hurts, and I had to give them the talk and be like, "Hey, it's not okay to call people chubby." And, Aunt B's been working on a bunch of stuff to try to be healthy. And, like that's like, they know, like I don't eat certain foods, and they're like 6 and
Right.
4, and they're like, "Oh no, Auntie B's gluten-free. She can't have that," But I had to tell them, like, "Hey, it's not okay to assume someone's pregnant. It's not okay to call somebody chubby." And the girl that thought I was pregnant at the event, like, she felt really bad. I had a conversation with her afterwards. I went up and I said, "Hey, listen, like, like, I've done everything. I've been trying to lose weight. We're also trying to get pregnant. So it's hard because I can't go into a severe calorie deficit yeah, but like, it's this give and take. And it's one of those things that it's just really difficult for me right now, because we really want to get pregnant, but yet I really want to lose weight so I could be healthy. And what I'm eating is healthy because I eat all organic, and with my job itself, it's a lot of working out and squatting and, lifting and like my camera itself is, probably, I don't know, a solid 8 pounds with everything on it. And I'm constantly lifting that. And so it's like, I have a job that is a little labor intensive. And it's also harder when you're a bigger girl getting around small areas at an event and things like that. So yeah, but it's, she apologized, and it is what it is. But I just want to be
Well,
smaller.
thank you, Brittany, for sharing that story, because I can't imagine, and I wouldn't even know how to react in a situation like that. And I think that really goes to one, throughout your journey or our journey together, you've always been open, honest with sharing with me what it's been like. And so I could tell that day you were asking for help,
Yeah.
and you were ready to make a change.
Yeah.
And so we had a conversation. I asked you, well, kind of what direction do you want to take this in? And that's when we started talking about I said, have you heard about these new weight loss medications? Because I knew you were coming from a place, you did everything you could.
Yeah.
And you've been trying, and it wasn't just for the last couple months. You've been doing this for several years that I've known you.
Yeah.
And and then also just giving you more information that these medications are helping you. And a lot,
Hmm.
again, it goes back to us learning, or doctors and scientists understanding obesity in a new way, is that it isn't just about the diet, and that there's like a metabolic component, and everybody is
Yeah.
unique and has a unique genetic baseline metabolic rate. And so really going back to understanding obesity as a complex disease. With patients, as you know, I usually don't use the word obesity, but I'm always using the word weight. And that's something
Yeah.
I've really learned, is to be sensitive to patients when we're talking about this topic. It's just because it can be so emotionally charged, is
Hmm.
that using terms like weight or weight management and keeping it
Yeah.
neutral. So on that day, we kind of brainstormed together. And once we started talking about these medications, I said, well, let's make sure you are connected to an excellent primary care doctor, and and I also want you to have a team of people to support you in this. I think
Hmm.
that weight and weight loss can be really tricky. It's about almost changing our relationship with food too. It's really complex.
Yeah.
So sometimes you need a nutritionist, even a counselor, a therapist involved, and also a medical doctor to watch that you are making sure you're drinking enough water to minimize any side effects, you're not getting constipated. So I was
Hmm.
really thrilled when I connected to you to a great primary care doctor who's going to kind of oversee you exploring these GLP agonists as a treatment option for you.
Yeah. Yeah. No, that was great. I mean, the doctor you referred was in my network, so I just had to switch and wait till the first of the month, which I actually had a visit with him this morning, and that went great. So it was like we're on the right track. So he said that we just have to wait 2 weeks for the insurance. But he was like, "What do you want to do?" And I said, "Whatever Dr. Soung said, that's what I want."
I love that you followed through on it, you know? And
Yeah.
I always look at, like, I'm your coach, I'm your advisor here in this journey together. And so amazing. And you should give yourself a pat on the back or a hug, because it's all about the positive reinforcement. Every baby step that you take, you're on your way to like living healthier and accomplishing your goals. And I tell my patients all the time, let's make small, realistic goals. And, one of my favorite ones with some of my patients, but Brittany, you've always been so amazing about diet, is I negotiate. I tell my patients, hey, well, like, okay, they don't want to do anything else. So it starts with like ask, right? Ask permission. How about, what's your favorite thing to eat? And they're like, tortillas. And so I say, how many tortillas do you eat? They're like, 10. I say, how about 5? Okay, half.
I'm
Or how
literally
about,
doing that with my husband right now, trying to get him to eat less. I like take half the chocolate bar away.
I tell patients all the time, like, realistic goals. I'm not gonna make you eat salad every day.
Right.
I want you to eat your favorite things. But what about eating less?
Hmm.
So part of this whole process is understanding, okay, if we're gonna one, defining your goals, and then two, setting realistic, measurable goals that you can that are attainable. So
Right.
I love that you followed through. I'm so excited for you, and I can't wait to see what happens next.
Me too. Hopefully, I'll be smaller.